In the AOD Workforce Review in 2020, it showed 398,596 nurses registered with AHPRA in 2018. 2,002 of these listed AOD as their primary employment. This is less than 0.5%. Of these nurses, over 80% are aged over 40, which brings into question what will happen to our workforce in 20-25 years when these nurses retire. This is only compounded by the fact that many nurses have the perception that poor health is due to poor choices in the AOD population. This can increase stereotype, stigma, and poor health outcomes for AOD patients as they cannot access safe and appropriate healthcare. Despite this, there are no dedicated, consistent undergraduate nursing placements in order to train the upcoming workforce. This could be because even though the benefits of AOD care is documented, there's a lack of support due to a lack of understanding of the roles and benefits. Reports show as many as 1 in 20 Australians have a substance use disorder. This increases their risk for secondary chronic conditions compared to the rest of the population, such as mental health, cervical cancer, respiratory disorder, cardiovascular disorder, and diabetes. As many of them also have unstable lives from either homelessness or incarceration, and low health literacy and low socioeconomic backgrounds, they are unlikely to seek help for more than a year. This can have a greater impact on their long-term recovery, as holistic medical care and AOD care has a better long-term outcome for the patients. This can be concerning because in the previous slide we talked about how there is stigma and stereotypes around people being able to access safe healthcare. If it is so widely integrated into our healthcare system, why are student nurses not being taught about it? This isn't a mandate in the mental health unit, and many universities do not cover it to an extent that students want, with 72% saying they do not get enough training at university to feel safe treating AOD clients. This isn't surprising, with nursing students saying that 67% feel there is a personal safety risk, as AOD patients are unpredictable and aggressive when they are under the influence or detoxing. This is one of the stigmas I try to break with running this program. As per university requirements, students are required to complete 120 hours for their mental health unit over 3 weeks. However, unlike traditional student placements, this has not consisted of following one nurse at that one job and see what that one person's role is. We have aimed to provide an overview of the entire AOD sector and provided training on what it actually means to be an AOD nurse. This includes covering topics like medication, the reward pathways, stages of change, intimate partner violence, community outreach, mental health care, primary health care, needle syringe exchange programs, safe injecting rooms, residential rehab, drug courts, forensic care, among others, in order to actually see what nurses can do in this sector. The impact this placement has had on the student nurses has been nothing short of remarkable. When asked if this placement has changed their impression on the AOD sector, many of them have realised a lot of their own stigma and stereotypes towards AOD clients. One student even stated they used to be scared of this group of clients, whereas this placement has shown her there's nothing to be afraid of, as they're just wanting care and support. When asked to compare what they learned at university compared to this placement, they stated that university just brushed over AOD and just went through the drugs people can take and their effects in a 15-minute lecture. This isn't surprising, as AOD isn't a mandatory requirement in mental health units. All stated that they wish it had been, as it is such a big problem in our society. When asked if this placement has changed your mind about working in the AOD sector, many of them said yes, saying that this placement showed them it was much less dangerous than it is made out to be. Many of them also stating that they didn't realise it was an area they could specialise in the future. When asked what they say to other organisations thinking of hosting undergrad nursing students for placements, they stated as they do not learn much in AOD uni, that providing placements would be beneficial in breaking the stigma around AOD patients. That there is a responsibility to the community in healthcare to find opportunities to educate and advocate on the behalf of the AOD community. My future goals for this project are to include publishing a research paper on the findings of hosting a student nursing placement, publishing a resource guide so other organisations can host their own students, and making AOD undergraduate nursing student placements more common so the upcoming workforce can see what we actually do and the impact we make to our clients.